Dearly beloved, thank you for tuning in and welcome to the audio podcast of Paya Memorial Presbyterian Church, Bantama, powered by the YPG. This podcast will feature life-changing messages from our weekly meetings. Join us as we explore the Word of God, learn and grow together in our journey as Christians, as we strive daily to seek a life of purpose and to live like Christ. We're excited to walk this journey of faith with you, and remember that Jesus loves you.
In fact, I said, Papa introduce me, no. Mood pa. Yana introduce me, sana say, yeah, the case as well. Then so, said the humanity, no. I was it me. Na, mema as a for many what depression is. We are first service into me say, brofo. So. Metiase say or say me de twi no so fifa mu kakra say de be ya obi o wa ha bia betiase depression yare kese ba ko a ha nipa dom bebre na ya na empepi no ye kasemu ana say ye normal ye mu say Ghana for and I say before and I say a Christo from Puno. Yana, I mean, thank you. Good. Yana, ye fan tra say a Nipanisu keke. Enti Nipanisua, ye first say, I was say Nipanonia and what they now the con, Sadiana, yenesan. Neso Sonia Sanetti. Depression adwemu yare na ya na empepi ye ka adwemu yare pe na obi a pe bia fa me pa cho enya sa nete adwemu yare ben ye chen yare a ye no hospital nyina if we say eno ma etwa ye ho ahia wo sunsanso a de ma ya adwene na saa no ma no se ekona ekobro ya ho den so a empepi no ya na edin ya na ye hia mo ansa na yetimi akon saa no ma no enti ye ka depression a ansa na kra na machichi mu no yare bi a esesa said the onipa no wote it changes the way you are. It is pervasive and it is persistent yade a eba ana say situation bi a eba wo so a ya na ne kono edin enti da bia no bo say eda so wo ho. It is basically always there. It's persistent and then it has a wide range of symptoms which I'm going to go through. A normal idea say depression and na ebi a nipa no walk and na depression na aba nipa no so no e do so bebre me cheche ni nyina mu na ade ba ko a ade kronti a me chance me kan ye say depression no e ben ye chen yare bi a etwa ye ho asia ne say so obi anim say in fact for a long time and all the education that has gone on, you say so be or diabetes. I likely say be a busiana with free mono, will be so war diabetes. In Tiani, I kind of say there's a history of diabetes within the family. Depression, as we have similar to that, and as a mental illness in general, a where busiani more, and you're very likely. Say oni ana ofia busuanim no obetimi ay vulnerable to it enti ya na e ka ne tra say ya minim say ye wa ha obi anim ne nana e bia wate ne din obi okura onim ne nana kan so onim oni pakro but the wate ne din po no na pomudin ho nsem no ya na e din say obi hu because unim say o nana bi ne afre no kwasi mensa bi wo ba bi a de unim ane say o nana bi say o kwasi mensa o sika pa Banapomudi hun sem de unim. Enti empepi no se ye busa ensem kakra na ye ka se ebusua no bibi sa wo mu a nipa de bebe beka zo de bibi se ni. But ye fa ne say esan se wontimi hu obia wo obusua mapomudi hun nti no. We start from the premise. Say yes, indeed there is some history of the condition. Enti se wonim abusuani a ɔbɛn wo a ɔwɔ saa yare no bi deɛ a ɛno deɛ increase wo risk of developing depression. Enti ebia wo nana bi na da bia na wamoa na ho keka wo fam na mo ka ne sɛ maame deɛ na yi wonim sɛ wonim no ɔbɛn wo anaa wo brother bi, then your risk is higher developing the condition. Now, there are deficiencies also in some chemicals. Nipa adwene mu no yɛwɔ chemicals bi a ɛboa yɛ yɛ de yɛtumi yɛ nyinaa. Sɛ deficiencies kakra bɛ mu a, yɛ na ɛno so trigger depression. Now, meka saa deɛ because sɛ deficiency bɛbɛ mu saa na ɛka o genetic makeup ne ho. Anaasɛ deɛ wo maame ne wo papa ɛwo aba wiase no deɛ ɛka bɔ mu a ɛfɔ mu ɛwo no, yɛ na ɛka ho. Nti sɛ if there is some deficiency in some particular chemicals, for instance, serotonin, if there are deficiencies in that, there is a higher risk that will be developing sardia. Now, enya no nko a, ya na yɛka ne sɛ ya na wa hwɛ abɛfa ne sɛ, oh, papa yi sɛ deficiency wɔ sardia no mu pɛ na kyerɛ sɛ me de menya bi, enya saa na ɛteɛ. Sɛ deficiency no wɔ hɔ a, risk no na ɛwɔ soro. Agye sɛ biribi bɛka ho ansa. Apart from that, no, apart from those family issues, a normal you experience it every day in our lives. You kita hudie ye kone ye ba. You major life changes. Uko school maybe from the beginning. Abofra ko school na we na walk secondary school. No pressure it was hard. And then kra na free SHS wo ho a computer kra na place di pa no. Yetimi place bi be eto ba bi na uti oya. Saa no many nyina major life changes are etimi kofa no maba. So some of them include wabusiani a wodo ne pa na say obi oben wo pa wodo ne pa na wa free mu. Ana say generally they are na friend loss. Ade bi a esom boma wo na afiri wo nsa. Etimi ye obi a wodo no. Etimi ye usika bi a na nka ebo ama etimi ye no ma bi. Na atwan say free wo nsa, especially the dance e ba yi. Msa afi na kakra ye build kakra in our economy. Ebeso etimi aba say dibre bi a ebi awo na atwan say free wo nsa. Mpe bi o atona bi o higher na make asafa pension and retirement ho. It is also a major life change. Aware a major life change. So wo ba a major life change. Wo free baby a wo akotena baby fufuro and no see a major life change. Ni nyina etimi contribute to it. Mon kai say medical aka say the family history and some deficiency in some chemicals be ma at high risk. Sa no may so be eba na we hunu musa na ama risk no so much even higher. The etoso yensa yare different forms of yare, different forms of medical conditions, especially the chronic ones. Yeah, na ne kwedin. They kind of chika say chronic condition yare kwankro. Eba said there is if it becomes very, very, very difficult to actually fight that condition. What they call hospital, Dr. Edmawedru, Dr. Shaw, we call review every day. But with Timuno, and the crowd in West, what's the radio as well? You say it will be cancer. It will be Yaria, you need to have one clone, I see no to me, sir. Into what Hona or Tessa no man and I say, oh, it's our condition. Not at all, I don't. Nay, you will say, and I didn't main co, Namin Copibi. But who do you say? I think I'm a copy. You are here now, Kohame. Because Yaria no say near see it. Sa conditions in cancer, stroke, even a very terrible accident. I be some permanent disability be cry no cry it's me a pushy and say a stressful event enough and also my risk a year higher. Apart from the family history, environmental issues we can. Then there is the experiential causes. Said there, Papa Kaino, a dear grand of Kofaba, Sano Main, Tina Sano Memi and says so. There is experiential causes. Ebia, a drobia o febi or ha, ya na, ebia o yare, a drobia doctor do atosuno, and the side effects, no, ya na, it said there, depression, etieno. It is very likely so be depression because a drubi a febina a whole side effects in it is. And they are not so difficult to deal with. But yet difficult when you have that family history risk, you know. Now we so as ako ka ho no. One we e ko twetwe ba na afi no na ne kona eden later on. Ensa any different normal yefa. Ensa ya de bia ya na empepi ne de adwene bi say oh wo fa nsa na wani so ayehye enye no kre. Ensa is depressant. Ensa de wo depression state ni. Na say netie wo fa nsa na epagya nkosoro pa eno ne ana de ani je ne ba no. Na ewia e de waba fom pa na de wo ba fom a se kakane na nka wo ha. E de wo ba fom a na de watra na de wakofom pa na e ba soro a emma ba bia wo first na aba ase e ba ase a na aka ho eno nti na se obi no mo nsa na obi sha ase se wo no mo nsa ade ba akwa just one domain of it emma nipa no ethical ensa no ne so ne say e de wo ba fom bia na e de wo ba ase na wa wo betinka say me nti say the first na metie no but ada wo be fansa no na say wo asa ba ho so biom nti na do ba fom a na wasa afa na do akosoro na esa do aba fom a na abehye bebi ana enye na wo mpe no na esa do aba ase nti constantly na do ba fom nti da bia no wo be pese wo be back to say the nurse party nti na akuso ye the no and here just one part of the explanation for addiction and alcohol addiction but ensa in itself is depressant so any of the high risk causes CB and high risk vulnerability CB. Then you take alcohol also there, then you will make yourself even much more exposed to depression. In the end, say, obi ne edofu bi anya akasa na papemu aba. Eno ne ana empepi ya na ete hu pa. Akasa ba na nipa ne ra ho. Traditionally, say any or no monsa dia eden. Ede akon de asi no. Ana odofu bi awu sa de esi pa odofu bi awu ne yenka ya no kakra odofu bi awu ore ahoho ukofom dada na wasa adom nsa na apija na de wakofom more so ensa worsens it obi a onom nsa bi anim sa de American because every time bi abenom nsa bi na say we occasional drink and pour onom nsa na ade achi a you see afraid dey be hangover but after the hangover no you feel not so right of yourself. Sometimes I check akra. Inti ensa enya dia I will say edeka ya brabo ho kra basically because it worsens depression. And the sa ho ne say depression etimi si emra yenya direct explanation dia to it. Ebetimi yes. Nipa ne betimi enya depression without any apparent explanation. Enti no ya na ne kono ya na you focus on ne kono more than baby a free by because in your baby you just have to fight it. You just have to find a way, a remedy for it. Now, I feel na maybe church depression mu pa what exactly it is. The ebema ye ka say nipa we depression no normal miensa na yedi kan hwe ansa. Sa normal miensa no e wo se onya mu mienu. Na onya mu mienu a e wo se sa symptom na obenya no e wo se ekosoa for about a month. And through manta enye depression. Eno nti normal we wo so go say ye nyina ya famu pen. But to da ye famu a month ni ndru na ye free mu. Wo free mu a enye depression. De edi kan ne de ya na Prof Kasim ye ka no anhedonia. Ana say interest a wo normal wo yemu. Asori ba say de wa ho keka tie wo ni je asori ho wo ni je ebia o TV program bi ho after the suddenly na as any je na wo sa anomanim nye say eni ho we wo ho but anoma no wo ho but eni je na anka wo hwa na say wo ya ewo mu no bo say swat eno ne friend no anhedonia no and I say loss of interest in the things that you like to do. The etosomienu a pervasive sadness areho bi e ba wo je ho ayeden pa etimi ba bibi timi si na wo ra ho and as wo ho kra na wotimi kai bibi na wo ra ho pa But saa awerɛhoɔ yi yɛ awerɛhoɔ a ɛba a ne kɔ no ɛɛde yɛn kɔ. Ɛtumi wɔ hɔ ara tra saa 1 month na America no. Then yɛbɛka ne sɛ ɛno nso so yɛ one of the main things a yɛhwehwɛ. Ɛna low energy. Ahoɔden a wode keka wo ho anaasɛ wode yɛ wo nɔɔma no wohu sɛ ɛso ate paa. Especially anɔpa. Wosɔre anɔpa a asɛ ahoɔden no nni hɔ saa. Na maka saa nɔɔma mmiɛnsa a mede kyerɛ sɛ saa nɔɔma mmiɛnsa no sɛ wowɔ emu bi a ne afoforɔ bi a ɛka ho a na kyerɛ sɛ ɛyɛ depression no mede kan ka sɛ ɛwɔ sɛ ɛtra 1 month. Ɛntra 1 month deɛ a ɛnyɛ problem. Wotɔn nɔɔma wɔ Kumasi Dwom Central Market na yɛbubu hɔ. Ɛde awerɛhoɔ bɛba worɛ bɛho wobɛdwendwene all of those things but bo sɛ ɛbɛn 1 month na bo sɛ oh nsɛm a nkurɔfoɔ bɛka akyerɛ nkura nhyɛ sɛm a nkurɔfoɔ bɛka akyerɛ nti no you don't feel like that anymore. That is not clinical depression. Enti apart from saa nɔɔma mmiɛnsa yi sɛ wonya mu mmienu na wonya deɛ aka ɛsɔ so a then we are saying that okay now you are getting to depressive state. You feel say why you're very empty. You feel very empty. Your inability to enjoy anything, and you don't need worse. Then you are feeling hopeless. You are feeling the loss in sexual desire, especially for those that are very sexually active. Then the loss of warm feelings for family and friends. So that closeness, affectionate feeling now, you see that it is not there. That is also a problem. And then when you feel some form of guilt or blame, sometimes you can't explain it, but you feel like you have to blame somebody for something that you are feeling. Or you just feel guilty that how you are feeling, you are the cause of it. And now, self-esteem is also shall say about for more, I can't hold it. And then told that isu as when you atata isu the kind of sound when you atata isu sad then tesi to so emra won said any the crop pot in here most of the time we can say the crop because say soon ba your mind is okay any waiting now says no misu then it will link up to the blame or the guilt you are feeling as so what the twins and yes so I will say there be I did the new consenka me real hosa na say me to me cry so sa enti sa no ma ya mabobɔ so ka ho in addition to that no usuban bi so sesa we slow and I say responsibilities I was saying ka we no if you no ma say we no fie and I say adwuma mu bo say eso tete untimi nye unim say okɔ adwuma mu a I was saying ka we A B C D anka ye enye too much for you but okɔ a we A B na say the aka no aye bibi basa bi sa and no eso say one of the symptoms that you should look out for. Then memory said the enka kind no man and also so esoti na day so do I be see ade bi so na why concentration there will be some difficulties in concentration and then say emuya den pa say depressive symptoms na ya ye kese pa and na sa ade we to aso afi wo dwene na say me kura ma bre kura me fi wiase. The suicidal thoughts they also come in. And they can be suicidal thoughts or suicidal feelings. And you will say, this is when it is very, very severe. And then, so we make decisions also in your daily life. I feel that decision making is also I had the Biana want to be making decisions and also so these are the behavioral changes. So suba mu nneoma be dey dia. Eno no me decide we buy because say woni obi a wo ben na saa no men na betimi dey hu say e bia saa nipa no depression bi na e bia e won so because we hu saa dey very easy to see. But the first one dey nya ni nyina na obi hu. I just nipa kra ka achiro. And then there is the physical ones. Disturbance in sleep. Whether wontimi na ana wo da sorry ntem and now that be we can't see another question and never a problem. There be a sa. So what that Emma was sorry now who say, when they are me die idea, assuming pepe there's no problem. But I never wow da me die, I'm sorry intem. Mean to me now. And my dasa, me da, my about 10 a.m. Me da, and random rare 10. Me sorry 10 a.m. Anopa 10. Hey, doors no do. And now if you for crash, I say complain, say oh that do. Then you know that there is something wrong. And then the lack of energy, my can't no answer that. And I did appetite. You lose appetite, or your appetite is also heightened. Now, the way is linked to weight gain, any weight loss. Inti se nipa na ye kese pa, ya na ye kasa me fo se nipa ye kese na chese atiye na ama na ye kese nya no kre. Se nipa no ye kese pa, it is possible say a depression. You're part of the depressive symptoms. Nipa no normal ha no. Ena enoma na ha no no. Odi I say what the aduane na e calm self down. Inti odi no nyina na o say ye kese. Inti say edidie ne ye bebre pa. And also message me edidie nya say bia da bia nipa no yo bia odidi pa e chese o depressed there bi. Nipa no ondidi sa but mo say within some time bi no na edidie na ye bebre. One no wa odiwe kakra no odiwe kakra no odiwe kakra mo say ene wa didi dodo sa na make. Obi wo ha wotimi didi pa de aduane si nanim ade obi di no ye mesho eno enye depression. And then ohunam timi ye oya emra wo nheda nya ade bia e wo say ohunam ye oya. Okon wachi especially okon achi ha. Bo say aye de ne pa utimi so utimi twa okon sei utimi twa okon. Na enso so o tene okon mu ana ye wo say de asa okon ne ye oya pa. Eno ya na most of the time tension and stress but ni nyina aka ho bi. And also, so you're just one of the physical complaints, especially will be a depressor or eka. And headaches, and it's our back pains, and stomach pains, indigestion, and I say changes in bowel habits. Said there, we did the here, and I say, we yamutai or yak basabasa be our said antiasia. And no, we no translation, and you say, hey, yeah, if you be our translation, baby. Oh, we no translate so. Enya de be yadwuma wa wo yam ne ehwie but mu ayemre eso e wo sanke mu yeden so mu nyeden dada bia na ase mu ayemre ahonte ase na wo mu ana ye o yanketenkete bi we be call hospital ye be all the tests so there is no infection, there is no bacterial infection. You don't really understand what is happening. It is part of the physical symptoms that come up. Enti saying that depression tie at least the maboboy ma unya a fair understanding what depression is. By omu types. The first one, the Cassian, the friend major depression, and no, and they all dysthymia, and they all bipolar disorder. Bipolar disorder, no, one of the mood disorders, but a can't, another phase be over any part of the depression, and no mania, and a manic phase, and no, and on the do and Nidia never honky can a cost so powerful. Now, a debut also an echo from past depression. Into Boa or was our condition. But major depression and the other in the womb, and no, a shall say suddenly. And there are possible triggers. Ubesham no na ABBSC when Nipanabra Bumuna Amasa DNOSC. Interfere with Nipani function. That's also one thing. I dear Nipan also, I feel any Nipan into me, Nejuma, Yabasa, Ne Nayonko Femu, and answer Nikita who dear Yabasa, the Bibia Yabasa. A bit me at also for months and years, and then the money major depression. A bar and Ejinamusa, it is persistent. Ejinamusa for even years. And now, and pay Pinia no go bet me at one time, bet me at 2021 in Unyaya, and that is it. Unyabio. Ubusu also a Unyana 2021, the Umwana Sababium, Umwana Sababium, sa, and only the major depression. Then we have the dysthymia. I said dysthymia na a mother form of the major depression. Who was our symptoms in now, but I know yet didn't be brain to know. There will be out me, but one who says, home foul, young cancer, home foul. But what's me, there will be a you know, you know, feel ye. Ubicabacasa, oh, that's how they be. I know my feels with the winning more home. There may hold yameno, there will be a cost. This time, ya be. Depression there were but and say the biana that's all. And Amaka bipolar no. Then there is could be a friend seasonal affective disorder. And also one of the depression. Then no na efa if you must say who says in so to talk. Ubu wa in so to talk say na and na osha omwa osha say moi. Not all the depressive symptoms now make no. Most are shall say about. I said now okay can go from the normal word in no incidents so you free rainy season in na echo. And also so and it's no main now a year the types of depression a woho. Now a normal ya near tade compano a psychotherapy and no ye dear ya na me the pa. Severe forms no ye the enroka home. Enti uo depression as a okona doctor say Fordjour and no nkyerɛ sɛ eni kwa so Fordjour and faka and ka say o aduro de enka ho. Empepi ni dia na ewo yetirim ne sɛ aduro me fa na ɛka me hɔ a na me yɛ ne den. Ye adwuma nim de na obi am pɛ sɛ fa enura psychiatrist and answer psychologist bɛka sɛ aduro we na fa. Na okofa na omu no ne de ofa ya no ayi bibi o me boa. Me pa cho just anetie. For depression, you know now obedasino and sesa bibia about you. The equine yari and equine. To say they offer antihypertensives, echo hypertension, and also offer anti-diabetic medications, echo diabetes. No, sa penalty. Sometimes, obeko doctor on ye psychiatrist and I say on ye mental health thing, but you know about trauma and maybe as I know the only problem obefa bibia anyo. Enti mesɛ mo fa nto no tirim sɛ eduru sɛ ebia ye de no ka ho a ɛno nkyɛ sɛ no bɛte aka so menka ne saa. Enti psychotherapy kasa ɛno de me ye kasa na meka no because obi nya depression na adwendwene de all dwene no ɛsesa ne nyinaa kɔ negatives. Enti ye de kasa ɛtwe nipa na adwene si negative thinking ne ho na ya twe na adwene si positive a enka obetimi adwene. After then, you consider the positives. Or now you necessary no na o free the symptoms na o nya no na e free ho kakra. E ko si say e be free ho kra. Enti yetimi de no so ko. Ene yetimi de nuro so eko. The mechanic say at least yehu depression say the etie. Yehu the types so. But the mechanic say uhu say obi ko saa tibie ni na akra wa ko saa tibie ni ma entra so entra ho nka say me de me nko na obi ahon ka say mabodam me pa cho me say am gina ha me hwa abodam fo enti ye wa doctor fo a omo hwa adwunu mu yare a enye abodam yare me sro take action na yenko hospital wo de opa wo ko poli a doctor fo wo poli nyina omo training no ye train omo in mental health so into ko polity said the whole general polia obetimi ahwew na wo do ato nuro so a ebeboa ama side no afiri ho se enye nuro so a said the etie no enye nuro a oberefe wa ma psychologist na wo de kasa aboa ayi sa symptoms ya ide afiri ho nti very important nti e was say we take action na we bia we bia so we take breaks why addicted Americans because so we are stressed up Emma or risk our water dano. A year heightened. Said the medical family history, Nessa Anomano. So, oh, sir, one take breaks were normal, a Juma William, and a normal William. Now, one Juma home times beer. A pusuma, we are much more vulnerable to developing depression. And take some rest. And then reduce, so you'll be our normal son. Make us say, reduce no teso kese pa obetimi aye se entiso na edian na chese wonsa no nom yache wo ya ate akaso enu ntinu hu hiamoa se nche ye dia a woteso ebe yi hyase teso na woteso na ebedu ba bi no begyan ya ye exercise kakra wo ye exercise a burning out some of the energy wo mu dada no se de be ya obenya the optimal level didi yie wadua ne die hia endidi anadwo and preko de bia najo normal very difficult to digest because sa normal no ebemua na esesa o chemical balance there wo ni pedua ni mu no and also so to me predispose ma onya depression. Establish a regular sleep pattern very important time out no manage regular and na analysis no na 8 no that 1 no the 2 don't do that make it regular time way dear mother. So when you man me dey be a hard dream pa na. Shemrama ho said this time my phone enye adwuma. Me say me about 8 o'clock after me a unya me. Phone is so pa ba after me a me hu me score me mfa. But who the other thing say anko. If you say why she time I would done anya regular. There be a unipedia and said yanka refreshing ho no and refreshing ho sa. Yare ba kwa ebe course bit me a course sa de ne pa say why she say year a depression. Enti ti na make say depression ye yare bia ebe ye pa. Enti say why she say o normal amana or especially one nana amana anya regular, you very likely to get depression. Somebody can and then and then I was saying unipe bia some form of strong emotional support. Sorry, yeah, one of the very good emotional support system. Now for a very uba sorry now enjoy kubia Mr. Join me. That's asafumuno, you could also join me. Who join me? It strengthens your emotional support system. Emma unkita mudia when you have food, a boama wapomudi so de a conkai. Enti having a very good emotional support system. Obu wa o kumase na busu afo na busu ani bia ni kumase ono kwa na o kumase. Pe obi a wo trust no bibi hawa wutimi eden e ka kire no. Anya de o ka kire na edu a race cross no obi atim. But de wo ka kire na ote wase a obetie de wo ka no. Na advice bi anase encourage say bi kra no be ka kire wa wetimi aka kire. And then focus on the meaningful, positive aspect of your life. Abrabona ye wumuno. Ni nyina anye toti. De enye beba. De ye no kra be kakra bi. Ma focus nyina anko de ye no ye kakra bi ne so. Umu ani kwa no nko so a ebe ye kese pa. Enti se da bia de esese life mu negatives no nko na wodwene ho a eno so push you e ma wo yinti. Mesrem ya mo ani nko positives no nko ho. Pace yourself, modify your schedules, and set small, realistic goals. Obi owa the goals are set no. E was so pa or no, so we kura won do ho. Media me person me president. Ghana ha. Nipa kakra bi na betumi president in your age group. Nipa no kromu sadodo. Bia nipa me ensa bi pe. It is how they no ka ho na o twe mu bebre a hard dream. And also so definitely generating negative thinking. And also Emma we at risk of going through this. In fact, I know my boss in no at least am I a very good understanding of what depression is and what to do to actually deal with it. But say obi obey obviously when who say what's or can ask much because a good support system for anybody going through depression. Nipane can ask much don't argue with the person. She said, if you ask me, no man call you, mammy. No man call you say, and you won't say, I am a promotion with Mamono. And you won't crack a ya or drive a car. Yes, we'll drive a Friday. Eternal. And he said, Ubi can hear so much about, don't argue with the person. Listen, what's here now? And man, that kind of support, man, needs to be muka, the woman be either, actually. And people no go or kasape. Now I say at the case be a son no. Ya page free so. Obi ubetimi atena ho atie de nipa na kan kwa. Wakra on kasa bi. O kasa wi a yo. Ene ye bebo ho mpae. Eno nko ano lifts a huge burden off the person. Don't insist that depression or sadness is not warranted for a particular situation. Ade a to nipa no. Se nipa no feel say why you depressed about it. En ka say ade we dey so we dey nti na why depressed. Yenye ne sa. E nipa no normal when you anko de depression and so anything on de no will feel that way. What there you might not feel that same way. Don't react with anger even though your efforts to help the person may face rejection or some resistance. Oh boys all try so be bo nipa no. Oh ene ya na oh ya bra sorry ya kick ho na bra sorry said be ya oni afofro kita ho die be ye Sunday oma. Wo frɛ na onfa. Now also now problem me boawa now cheda de wuye de e na fa ho e pa cho enye ne sa because wo boa nipa o te sa edin resistance and rejection ebeba but also cost na obo nipa no na nipa no be nipa no free sat bi anima obeda wase pa because baby ana owo no na enya ade a obetimi de wadwena bu say na o feel it is no man na me feel me hu ne say you hu depression hu se sia prepare ya ebebo yi nyina ama yetimi deal with depression enti madam wase my ne ka say 20 but akwa abo so madam wase pa.
Thank you very much. My point now, what be some questions? Your time no pronounce here here nti. It's messing na kamach no ha mo fa bi mfam ma na. Bajo.
Mpacho, my question is Mintimi who say me na me stress and answer at the same. And Crawford be how many could be my stressed. It's been 2 on for an hour by on day. If it's a work as I know say no boy, it mean my stress and answer means suspect one.
Papa me asa dear no. I no cre position a woman dear. Ubaya stress because who mu say sa sorry ma join ku a e na asafo no e konkan. Enti se wo monye ye no wo dear wo yes stress. But say the mekan no e was wo resources a wo deal with wo stress. Ubetimi aka say wo nipa ho adwuma na meye kakra wo mo beti de meka no ana me too amofuma ho me pa mate say ene me ba ye me di bi aka ho enti at least obi a so ba o de bi kakra ka ho a na o ma dwene koso enti wonim say nipa ho adwuma na wo ye no enti wonim say wo mu a nkuo no ebe ye akese a safoma no na be jonjon ni amana ya akese eno beti stress no so enti e true e wo na wo ko stress bu.
Me ba cho ba se musa ni se ye wo age limiter obi wa onya depression ana se ye wo age group bi a wo mo ye omodu sa age no a omo ye affected ana.
Interestingly, you shall study depression. You first say a penifo nkwa na depression. Now you first say obi a obone bra when you know depression, but I'm afraid you know BCC. But I'm afraid depression. I'm afraid I'm afraid depression. No, almost symptoms are quite different from the mebobosi. I'm afraid there our excess energy. It's not the album and the energy no come from na wamwa there be. But the obi who pass I'm afraid depressed. They say, "Oko school then talk about also." Or irritable. I declare why irritable. They say. The whole feeling on pet as soon as mofra and no magudi no will be the agroba before no will be the agro for no one penisa because baby an argument no and yet the energy home into be the agroba the hosana no one say any paneko into one of the main things I did whom say I'm afraid I say or ya depressed or bekun fie or bekun school wo parents now one in it no ade bi anya ade bi akra was say and Cabofani before Bos and Buff. So why here ye are over Bobofran? And that's why because Abofani are carboni, but nay because we're depressed. Said a mechanic, and no may try and worse it because of depression. If you can't know school crana will be able no. If be a not teacher, and if you can't send be a dampen esteem. And until now, yes, I am an intoka the doors because be our name now for 4 years. How can anyone know there be an omni conflict? Not there be will show that kind of say a conduct pervasive conduct behavior. Now I don't know say depressed. So you will not find abofra or culture say me energy come from and normal me ya manage no manage there you won't see that way. They are near the who yes sad you who and then we probe more then we find out other environmental or experiential causes a ebema abofra no aye enya saa condition. Okay.
Mbacho, depression said you okay to me lead to a dambo and I said to me lead to owo.
No correct. In fact, none of the mental health conditions, over 400 and something. Mental health conditions are never open. We do about them. In fact, the damn one year your vocabulary. Now, none of the mental health conditions a cause of death directly. They are close in causing death, a depression. Why? Because in depression, the depression to me is so high. Now I shall say suicidal thoughts. Now we have suicidal plans. Now we have the energy, the small energy or the executive suicidal plans now. Because any panel say now who didn't know for my I didn't know the but ada ne ho be yeden kakra bi no na ode aye saa de na opese oye no enti eno pa na ya na etimi cause death na one of the akoye said the way are ensatie no very common but it is the most dangerous drug. It's the most dangerous poison. Sana depression here, it can be very common but it is the most dangerous out of all of them. The Akano will not push you to death, but depression can push you to your death.
Okay. Papa Mpacho, my same is minister research bi wo a but me conduct here. Pese bi say e man ni mema. Ayi for pa na etanya sa wa hawi. Na my same is about ni ntia mi bi sa ne say em say esun so ekwa bi so na em say edusu minim de but ubechem kakra ma me. Mema e si be me nsu. Di asam atu be ma na esu osu no. Yesi be me nsu na wa mene but oba obusua na no ho ntem pese bi say e man ni mema. I for na depression ta ha ompa that's
me that's if it is here no you shall say research in depression no now you feel say there were huge differences in the two sexes. Now you feel say a man in your depression pa che mema enyo no correct. The most current research I ever in actually say despite in so sa you do it in this particular community. Most a man or more of the depression, and then you do it another place, and then you realize a man also with more depression. Now the difference, the reason why we got it wrong in the beginning is say a man report to the depressive symptoms, a member would not. So ocean suicide rate, a member the end was through. Why? Because on reporter to say by West, then he would execute it, and member cast on execute a suicidal planner. Obey. We and now who said the Okano, yea, part of the world, no, Bema to Bema the new council soon to know. Bema a yes, Bema crown on no dry, and you added be. Oh, caught to be a more day crown now. Said by a from Bema, I was all come on to now, meow, essay. Into the one cap, but not a cost with him because I had a problem into no. A cost with him. Into the BS member there, only affection for Omoma. And I see an Otiatia Omono. It was because they were going through so many things that is making them depressed. Yes, I say yes, our research, current ones, we realize that there isn't a disparity. I'm saying the second part of your question now will be something on Mirifikaka. Esun, yes. Esun is a catharsis. Se nipa ne overly stressed and now overly overwhelmed by idea of famwa. Idea ba kwa ya na ebo amanitimi ifi wo yesu. Esun in itself, esun is serious. It's a very interesting thing. What it does within the human brain is interesting. Se nipa no go through sadina or some chemical reactions be within the brain. Sometimes it balances it. Sometimes it worsens it. Because obiwu na se wusu to atwaswa. That means it is part of the negative symptom of depression, the crying spells now. Ubesu sa, and sometimes you don't even know ubesu oja isu kra untimi nyai. Then it's becoming a problem. But if there is some negative thinking, and now says some difficulty you are going through, now you feel like crying, and you should cry. In my practice, obi no must stop on the same suda. Obanas is soon tight hour, make us soon. Obi anyha, menon kwana wa asa. You cry, and it actually pushes a lot of emotions away. It is soon here, pa. Now, no credit say dear, mekanwaha. A member soon your trim, a member to Miss Mani. Bemen soon said, Bedlam, it has a bemen soon bedlam. It was a bemen to Miss. So soon as a chewa, would your kosha baby, no soon. Usua, Oba no power him. Anya tradition for because I'm pa bemen soon, but was soon or them. And here, so was a bemen so it's Miss. It is sanity. That's
Big boss, Pacho, the investment in Busa, and he said the place. When Fanny said, Ubi a big company, and I invite him to be a boss.
okay.
The boss no, a money in a handle. Because you are more, may 10 many actually, may a farmer mind, may share me actually. Me and Cassandra said, okay, so we not time, Mamma Daddy, me not time on some Mamma Daddy. So involve Ben Minya, me and Cassandra, many people.
Okay, good. If I said they all describe no, and yet a idea very common, especially in the scenario now described here. Where you're boss of a company, a Jumane super, I was all shaha, I was all shaha, I was all shaha, I was all shaha. Wow, feels so social. Now, wow, sunya and rema. In paper, near a real fear hokakra. Say, who was our situation in one? I dare back a bum anymore, meet me, meka. And I, at the solve our situation, say. And also finding ways of delegating some of your responsibility, especially if it is overwhelming for you. Obi owa, utimi deal with it. And also obi owa, said it was for training and agile. Utimi ye. Mame fanya example. Ejuma ye nyina ye, yesi edin ana meboa. So obi ejuma edin ana meboa. Minim obi a wo wiasem ha na ejuma nyedin. So ejuma no kra set na gate ya no na hwe nkrofo etwam kra na kan o kra edin. Obi ejuma edin. But ye nyina ye de ni kosi. Wo de wani to obi fufuro bi ejuma ho a utimi say ejuma we de mintimi nye. For instance, President of Ghana, with the Ghana Nkwa. Now they also run up on out here radio. If you are a president, would you be able to handle it? So many things you have to focus on. But when you delegate, it is possible for you to even have time for yourself and be able to focus on the most positive part of your life. So they okay, you have branches in the door, so you have somebody who is supervising that job. Maybe why you going to say only anybody come once a week? That is okay because you are not dealing with that particular branch every day. Even if you are dealing with the branch every day, you can set a time that you deal with the branch. Maybe at 5 p.m. Before that, you have the time for yourself for other things. But at the same time, I can bet you to be beyond your resources, your cognitive resource and your emotional resource. And not there. Say, that history of depression and the history of some mental health disorder, which they can say, because of that, manage your activities by delegating when you need to and going on breaks when you need to. We live. Don't compromise on your leave. I know people will be 5 years because uncle leave that. Or say, or hear they say, uncle leave that into your abaso. Obi amo abaso. You are killing yourself. Go on your leave. Use your leave well. When you have your leave, use it to do things you love to do. Things that will relax your mind. Who could leave grandpa and far phone? You say, phone is a very dangerous tool. It takes all your stress along wherever you go. So, but you can start delegating some of the work. The person might not have a particular position, but then you have delegated some. Then it will take off some of the stress away from you. Thank you.
World Health Organization defining mentally sound person as a state of complete physical, mental, social, and moral well-being.
and even spiritual.
And then it goes on to say 25% of the world's population are mentally sound. It definitely said they will carry depression in it will need purpose.
Okay.
Now, Ubu are welcome as I said, okay, enough any Ukoboni de Rukra. And the MSN saying the appropriate quotas are if you will be experiencing depression.
Okay.
No more solves are appropriate.
Very good. You, Medasi. In fact, the Rapeka no correct. My boss so that my messa boss will be on. Say, oh, go through some of these symptoms. I'm a boss, yeah. Who say me the kind they won't for a new and they are very easy for you to see. So we go through sad area, and I'm saying what this part of our world means. The first point of call might be our ben somebody who can give emotional support, which can be any of us. But that is the quasi first point of call. The first one in itself is the hospital. Any consulting room at all, especially general practitioner. Until confirm say no, a polyclinic. What the doctor or Doctor Bia, ya training a Bia, or you qualified doctor. No. When you have some training in psychological health or mental health, I can't the training no. It is a qua. What do one share doctor no and ask into the baby or direct work no is always the right place. Okay, what about me? Me who say anything there you want me so call this doctor we and I said this facility we. A honor never boam waiting me a baby or so. With depression, sometimes it might look so normal. It might feel that the normal things around you. It is not. It is if you are going through this, go straight to the hospital, tell the doctor your symptoms, the way you feeling. If it is possible. Sometimes it might not be possible for you to work there yourself. You might need to be our emotional support. The worker was my channel. One never motivate you say young hospital. It is this mental health condition and answer depression. No, I can say koha. Now, the best place is to go and see a psychologist, a psychiatrist, a psychiatric nurse, or any of the mental health professionals. They will know exactly what to do to give the remedy for what you are feeling. So the best place is a mental health professional. Jensen, ubia obekono ubiano, obetimi adirector, and also obetimi ma remedy na. Here a day I want to be ban. Inti medas.
Pacho come for some busa some kakra.
Okay.
Pacho depression menopause different and answer because we be a hot man or yes answer na na wo kan bi. One ne to obi na so jai no nya menopause. Ti no sa na so mbeka ne say.
No correct. Menopausal symptoms no. And it's a depression. It will be why it's a depression. Maybe the irritability part of it. The antenna before abba. And I say the hot flashes. But hot flashes is not part of depression. Now, said the old can and paper no be a kind of hear some beer a tete man pay. Yes, see, oh, Jai when menopause because of him fear already. Yen eyes are the neka. Who's a make a can no be any can say. And you can say argue with Nipana or can hear some. And you can say your bottle say I don't know how can I who here and true. And he said your kind menopausal symptoms and depressive symptoms are very, very different. And he said who go through normal bubbles yeah. Who say menopausal symptoms. So who say normally they are a depression. So call hospital that you show. Mo bian can't just say menopause now also phone ten and can say okay so almost a menopause into me and you're no correct. So you're very different. I hope say you're okay.